start with hormone shots.
Yes, let's talk about the shots.
I have PTSD.
I know.
Flashbacks.
Yeah.
Okay.
So they can come in these handheld like pens or really, it sounds scary, but they're actually really tiny, thin needles. And what you're doing is you're injecting hormones that are designed to try to mature as many of the eggs that we can. A lot of people don't realize this. You have millions of eggs, right? You're born with millions of eggs. And at any given time point, you only have a small subset that are at the surface that we see on ultrasound. And those are the ones we're trying to capture. So you're taking these shots for only 8 to 10 days. A lot of people think it's for months. It's only for about 8 to 10 days. And we're trying to get all of them to grow. And we're also having you take shots that are designed to prevent you from releasing those eggs. We want to trap them, grow them, and we're monitoring your progress by having you come in for maybe 5 or 6 visits early in the morning.
Because we have here, these are 2 ultrasounds. We're going to show you one without drugs.
Right.
And then you're going to explain what we're seeing here.
Yes, on the left-hand side, that is how your ovaries normally look on ultrasound. Those little bubbles of fluid each contain one egg.
Unmedicated here.
Right.
This is what it normally looks like.
And normally your brain sends a signal each month and causes one of those to get bigger and release an egg. That's called ovulating, right? But when you take these meds, you're trying to get that picture on the right. You're trying to get all of them to grow because guess what? At the end of every cycle, those eggs that came to the surface, they get thrown out. So you either use them or lose them.
Right. So this is what happens when you start your hormone shots. Then doctors monitor your body to see how many eggs are developing with blood tests and ultrasound. I would go at 5 a.m. in the morning because they didn't want people to know I was secretly trying to get pregnant. They like smuggled me into the place. You go in.
I was 6 a.m.
6 a.m. I probably passed you. So you go through in the morning. They check your blood.
What do they check? Same-day results. We're checking your estrogen levels. We're also figuring out, do we need to add or cut back the medication?
Because the medicine flows. It's not just a one-size-fits-all. So depending on what your body needs.
Right.
Next, you get what's called the trigger shot.
And let me tell you, it is triggering because we tell patients this is the most time-sensitive shot you're going to take. It is taken 36 hours before the next step, which we're going to talk about, the egg retrieval. And it's the final step in maturing the eggs. And you have to mix, a lot of times you have to mix the fluid into a powder. And people get nervous because it's time sensitive. And
you do this at home?
You do this at home, but there's a lot of support and instructions that are given. And then,
everyone gasped at home. What did you think this was happening? They're like, at home? But this is demystifying. This happens at home. In your case, were you alone?
Thankfully, I had a support system. I had my siblings around to help.
All right. But some people are really doing this all by themselves at home and measuring. So you can imagine how nerve-wracking.
You learn a lot very quickly.
You learn a lot. So you mix your...
Yep. And then 36 hours later, you're coming into the clinic for a very minor procedure.
It's called the egg retrieval.
Egg retrieval. Exactly.